Hi everyone, welcome back to my YouTube channel. In today's video, I will be sharing with you CMS proposed rule for fiscal year 2023 Medicare Inpatient Psychiatric Facility Prospective Payment System. Let's jump right in. On March 31st, 2022, the Centers for Medicare and Medicaid Services, or CMS, issued a proposed rule to update Medicare payment policies and rates for the Inpatient Psychiatric Facility Prospective Payment System, or IPF-PPS, for fiscal year 2023. CMS is publishing this proposed rule consistent with the legal requirements to update Medicare payment policies for inpatient psychiatric facilities on an annual basis. Let's start with proposed changes to payments under the IPF-PPS. I will go over the proposed updates to IPF payment rates first. Total estimated payments to inpatient psychiatric facilities are estimated to increase by 1.5% or $50 million in fiscal year 2023 relative to IPF payments in fiscal year 2022. For fiscal year 2023, CMS is proposing to update the IPF PPS payment rates by 2.7% based on the proposed IPF market basket update of 3.1% less a 0.4 percentage point productivity adjustment. CMS is proposing that if more recent data become available, for example, a more recent estimate of the market basket update or productivity adjustment, CMS would use these data as appropriate to determine the fiscal year 2023 market basket update and productivity adjustment in the final rule. Additionally, CMS is proposing to update the outlier threshold so that estimated outlier payments remain at 2% of total payments. CMS estimates that this would result in a 1.2% overall decrease to aggregate payments due to updating the outlier threshold. Comment solicitation on IPF prospective payment system refinement analysis. The IPF PPS was implemented in 2005 and uses the adjustment factors derived from the original regression model. Working in collaboration with a contractor, CMS has undertaken further analysis of more recent IPF cost and claim information. The report on this analysis is posted on the CMS website, which I have pasted on this slide. CMS is requesting comments on the results of their latest analysis as summarized in the report. Proposed permanent cap on wage index decreases. In order to mitigate instability in IPF prospective payment system payments due to significant wage index decreases that may affect providers in any given year, CMS is proposing for fiscal year 2023 and subsequent years to apply a 5% cap on decreases in the IPF PPS wage index. Specifically, CMS is proposing that an IPF's wage index for fiscal year 2023 and subsequent years would not be less than 95% of its final wage index calculated in the prior fiscal year. Principles for measuring healthcare quality disparities. Consistent with Executive Order 13985 on advancing racial equity and support for underserved communities through the federal government, CMS's Equity Plan for Improving Quality in Medicare, and CMS's Strategic Pillar to Advance Equity, CMS is also committed to addressing persistent inequities in health outcomes in the U.S. through improving data collection to better measure and analyze disparities across programs and policies. As disparity initiatives expand, it is important to model efforts off of existing best practices. CMS is seeking comment via a request for information or RFI on considerations that CMS can consider when advancing the use of measurement and stratification as tools to address healthcare disparities and advance healthcare equity. CMS is seeking comment on key considerations in 5 specific areas that could inform their approach identification of goals and approaches for measuring healthcare disparities and using measure stratification across CMS quality programs, guiding principles for selecting and prioritizing measures for disparity reporting across CMS quality programs, principles for social risk factor and demographic data selection and use, identification of meaningful performance differences, and guiding principles for reporting disparity results. Comments to the RFI will inform equity efforts both in behavioral health, mental health, and substance use by CMS, as well as the Inpatient Psychiatric Facility Quality Reporting Program or IPF-QRP. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel. Thank you for joining me. Bye now.